from the Fox 26 studios.
Next, a life-changing and uterus-saving solution for treating painful fibroids. Well, welcome back. We're at 9:30 now. Uterine fibroids are a painful condition that affect a lot of women. The most common treatment is a hysterectomy. However, doctors now have found a solution that saves the uterus. Dr. Jerome with Conroe Women's Associates is here to tell us all about this life-changing advancement. Good morning and welcome.
Great. Thanks for having me.
First of all, let's just catch our viewers up in case they don't understand what fibroids are. Can you explain it to us?
Fibroids are a smooth muscle tumor of the uterus. They're common, about 75% of women have them at some point in their life, and about 20% or a third of those end up symptomatic.
You call it tumor, but it's benign.
Correct, it's benign. And the typical procedures are for fibroids in the past have been hysterectomies. And we also do myomectomies, which we can also do robotically as well. But now we have a procedure that's done outpatient under laparoscopic and ultrasound guidance. That's a uterine preserving procedure, and people usually go home the same day and they're fully recovered in 3 to 5 days.
You're the first in the Houston area to do this?
Yes, ma'am.
This is a big deal. We're talking from going from a major surgery of a hysterectomy, which can often be life-changing with hormones, to they go home the same day.
Yes, ma'am, same day.
So what happens? Can you describe it to us?
Yeah, so this is the actual handpiece, and it goes in through the skin, and we do it under laparoscopic and ultrasonographic guidance. So the ultrasound's here, and we also see the TV, so it's all safe and under direct guidance. It's kind of like doing an amniocentesis. So then the device goes into the fibroid, again under direct visualization, and then I don't know if y'all can see this or not, but this, the probe expands.
Yes, it almost looks like little hairs are coming out here at the very end, or little wires.
Yes, ma'am. And then we have radiofrequency energy that comes through that device and is calculated based on the size and the diameter of the device of how long it goes. And it denatures the proteins and shrinks the fibroid by an average of about 44%.
My goodness, how long does it take for it to shrink like that?
The quickest shrinkage is within 3 months, but it occurs over the entire year. But you can actually, we've done these in the operating where you can actually physically see them while we shrink while we're doing them. Yeah.
This has to be life-changing for your patients, because this can be a very big problem for women.
Right, and we've seen people that in and out of the hospital getting blood transfusions and not really getting treated, but we can do this now outpatient, be home the same day, symptoms, and completely recover in 3 to 5 days.
It's FDA approved, so insurance says that, do they cover it?
Most do. We have a couple that we're working on, Cigna in particular, but I think we have a meeting with them coming up pretty soon. And it's been FDA approved since 2012, and it's a great alternative for women. So
approved in 2012, but you're just now doing it, right? So it just took a while to get things going with it?
Yeah, I think part of the problem is they were having a time getting the studies funded, but it's just taken off gangbusters here in the last year.
One thing in all of this conversation that we've talked about surprises me the most is that 75% of women at some time in their life.
Well, that's based on pathologic specimens, so if you look at hysterectomies, you can actually see the fibroids, and that may just be small, but I mean, 25% of women will be symptomatic in their lifetime, and a lot of people associate it with bleeding, but it's also the bulk symptoms, and this is a great device for reducing the bulk.
Yeah, if you take a look at all of those symptoms, that is not fun for anybody, but you're trying to make a big difference with this.
The other thing that's real good about this, we don't have FDA approval yet, but we have some pregnancy data coming out that in addition to doing the uterine preservation, you can have normal vaginal deliveries, which you can't with myomectomies that invade the cavity.
All right, thank you so much for coming in.
All right, thank you. Appreciate us having it.
If you want more info, goodbyefibroids.com, a great resource for you.